Hello, my name is Dr. Diana Cornerstone, and I am here to present to you the clinical trial called Cancer Crammers. Now, this clinical trial is determined to present a solution that is more efficient than normal chemotherapy for those with acute lymphoblastic leukemia. Once again, the clinical trial title is Cancer Crammers. The description of the subjects are those with acute lymphocytic leukemia with possible symptoms of frequent sickness, frequent weight loss, swollen lymph nodes, and exposure to radiation. Typically, these subjects are experiencing symptoms at a young age, including bruising, fever, bone pain, bleeding gums, and frequent infections. The potential risks that heighten someone's vulnerability to getting ALS or acute lymphoblastic leukemia is previous cancer treatment, exposure to radiation, genetic disorders, or having other genetic disorders are already incorporated in their DNA, like Down syndrome, and having a brother or sister with ALL or acute lymphoblastic leukemia. Acute lymphoblastic leukemia is derived from a mutation in the DNA that causes the bone marrow to allow the bone stem cells to keep blood stem cells to keep reproducing and replicating, and it eventually creates a tumor, and this stops the white blood cells from being able to grow, and it might crowd out the natural healthy white blood cells. The benefits of our proposed method of eradication of cancer is it kills cancer cells, it shrinks tumors, and it eases signs and symptoms of cancer. Now, the route of administration for our drug is it's basically a chemotherapy with a direct endpoint where it has a direct cell that it must eradicate. So it's basically a chemotherapy with a thiopurine. This method is a directed point-like eradication of cancerous cells, like I said. It also detects molecular changes in cells. So it's designed to detect it and then go in to the cell and then do its chemotherapy job. Also, we included a small amount of thiopurine methyltransferase, also abbreviated TPMT, to regulate the amount of thiopurine that is being incorporated into the cell, because thiopurine will kill all cancerous cells, and so we don't have an overflow of that. We need something to counteract the potency of our chemotherapy drug. Our targeted cells are cancerous cells, so like I said, the chemotherapy drug will go directly into the drugs with significant molecular changes that just keep reproducing and reproducing rapidly that will eventually cause tumors. So our drug will detect it, and then it'll perform chemotherapy on that one designed drug. Specifically, it will target blood stem cells that result in the overproduction that result from the overproduction of lymphoid stem cells, which is part of your bone marrow. Now, the target cells receive treatment with nanotechnologies that enter the bloodstream. So once the chemotherapy enters the bloodstream, it'll spread out and disperse into the specific cells that have a tumor, or specific cells that produce a tumor, or the specific cells that are reproducing rapidly or too rapidly. This selectively allows the production of lymphoid cells, so we don't get too many, and there's not an overflow. This controls the rate of which they reproduce. As you can see here, a blood stem cell transforms into a myeloid stem cell and a lymphoid stem cell. And these are the ones that cause ALL. And your lymphoblastic become your white blood cells. These are all your white blood cells. So those with a tumor or a mutation in the DNA that codes for a mutant lymphoblast will totally mess up your white blood cell system, which is what causes your symptom of frequent infections and other immune responses that are not proper. Okay, to release the drug into the target cell, we're using the chemotherapy drug as a thioprine. It can be taken orally or injected in the body in this clinical trial. So what it will do is once it enters the bloodstream, it will attract and bind into the cell. So it will go through the bone marrow and it will find its blood stem cell and it will attach to it. And if it's reproducing rapidly or it's a mutant cell, then our drug will perform like a normal chemotherapy, just more directly. Once inside of the cancerous cell, it will self-destruct. So the drug will self-destruct. And we're using the chemo drug as a thioprine. The destruction process is using chemotherapy, once again, which is the use of cytostatics. The trial objective and purpose. The goals of this clinical trial, is to determine if this projected method, our projected nanotechnology, and our projected method using nanotechnology to specifically set out each individual mutant cell. And the second goal of this trial is to determine the dosage. And our projected method must work long-term, must work better long-term over the standard chemo, which is what we're trying to determine in this clinical trial. Our hypothesis is using as a thioprine selectively in a nanotechnological method will demonstrate greater benefits in the patient population for at least up to 6 months than the patients being treated with standard chemotherapy. In addition, selective azathioprine treatment will leave healthy cells undamaged, unlike normal chemotherapy where you get nausea and hair loss because of damaged unhealthy cells. Selectively picking out the cancerous cells will like undermine any risks of developing cancer from that chemotherapy, the return of cancer from that chemotherapy. This will specifically eradicate each and every one cancerous cell. The benefits of this newly designed treatment is basically what I said. It's basically it won't kill healthy cells because it's selective, and receiving hair loss, return of cancer, or creation of new cancer or damage to any tissues or other cells like heart, nerve, or lung tissue will be less likely to occur. Now, our trial design is based on the cohort method. We are going to gather all patients, all different kinds of patients suffering from ALS. They must be at a young age, though I said, and we're going to split the group in two, and then one will have the traditional chemotherapy kind, and the other will have our projected nanotherapy method, and we will follow them for up until 6 months to make sure that the cancer we need to make sure their prognosis is better, like it turns out better for using this drug, and it's that much drastic, so we know whether or not we can continue with this drug. Now, our selection of subjects will be based on their overall health right now. So they must have no other underlying medical conditions such as nerve damage or heart disease or heart failure or irregular heartbeat. And it's only those at a young age, so somewhere between the ages of like 6 and 16, somewhere in between there. Now, our assessment of safety is what we prescribe our doctors and our clinical technicians to give to the guardians of those who have children that are participating in this clinical trial. So we will ensure that all parents or guardians of patients are either well-read or well-informed over their type of chemo or over the type of chemo that their child is receiving. We have seminars planned, and we have a whole website that is based off of the safety precautions and the procedures of the trial and all that. Also, proper warning of the side effects and correct procedures must be mentioned in a pamphlet that we have created. It's a tangible reference. It's a tangible reference material that is readily available to our guardians and their patients that are receiving treatment through this clinical trial. Thank you for watching this today. I hope this was informative, and I appreciate you taking the time to allow me to come and present my projected design. Have a good day.